I was just able to send Jumana a request. Let me try again. Hi everyone, welcome back for the third time to Cha with People in Medicine. Today we have Dr. Jumana Al Helal with us. She is
Hi.
hello, finally. This is like a new technical issue every time. Can you hear me clearly?
Yes, can you?
Yes, I can. Great. Thank you so much for coming and talking to us today. So, should we get started? Okay. So, a lot of people that are joining us today are juniors, so they might not know where you are studying right now. Could you tell us about where you are and how you came to study in CCMU and about your internship?
Well, my name is Al Hilal. Currently, I'm general surgery residency. I went to study in China, CCMU, because my dad used to work there. We lived there 6.5 years, but during internship, I came back to Saudi Arabia to do that internship.
So basically, you were one of the only people in our school who voluntarily chose and did an internship back in your country. And I think you were also the first one to ask our teachers to have a program where people could, if they wanted to, choose to study in their home country. And because
Yeah.
of COVID, a lot of people had to do it without wanting to. So why did you make that choice on your own?
Well, honestly, during medical school in summer break, come back here in Saudi Arabia, I used to go to the hospitals and do like elective internship. I just wanted to be more how medicine is practiced here and the type of training that the interns get, and just to know the route of how to get into a residency in Saudi Arabia, being that I studied outside. So when I came back to China and I started comparing like the internship between here and there, it was totally different. And I also did some research and I found out that even if I did it in China, I would have to come back here and repeat it again.
Okay.
So I was like, what's the point? It would be much more better if I just do it one time here.
Yeah, makes sense.
I wouldn't get the much of training that I would get in China, because to be honest with you, I'm not very fluent in Mandarin, so I would.
Yes, I think that's like a very big factor when you're training in China. You should know Mandarin, even though it is a course in English. It
Yeah.
is definitely like during internship, Chinese is like the main language of communication.
Yeah.
And I felt like when I came back, I learned a lot more in like just 8 months because I was able to communicate in a language that's more comfortable for me.
Yes. And like the basic things like writing a note, doing a consultation, discussing with the other colleagues.
Yeah.
It was so different. Like it's a whole new world, because
It's like,
you're only observer, but when you
yeah.
actually put your hands on and start doing that.
Mm-mm. Makes sense. So, why did you said you chose to do your medical school in China because your father was already working there, right? What about after right now you chose to do your residency in your home country, that is Saudi Arabia. Why didn't you choose something like giving PLAB or USMLE and going to a UK or say USA? Because a lot of people did choose that from our university.
Actually, the plan was like that for me, like to start doing USMLE. But then when I came back here and I, get to know the programs they actually offer here, there's a lot of fellowships that they actually do residency here. You get like a fellowship and they get to send you outside, and you choose like whether you want to do. Mainly now for surgery, they're going to like South Korea for
Okay.
surgery and everything laparoscopic. So that was fun for me because I wanted surgery, and I see that they're focusing on surgery in that aspect.
Okay. So
And
the
then,
fellowship that you sorry?
after like I saw that, I put the US. I'm like, okay,
Ah.
I could give this a try and see how that goes. If it doesn't work, maybe it's my second plan.
Okay. But I think it already didn't work out for you. A residency is like a postgraduate program, right? It's like you
Yeah.
already are in the step, you already starting to become a surgeon. So initially, I remember when we last discussed, I think you had taken up OB/GYN as your choice of subject initially, and then you shifted to surgery. Could you tell us about a little
The problem.
why you decided to
Um,
shift into surgery?
we'll see. From the beginning, I wanted general surgery, but I didn't match at the beginning. So I was like, okay, fine, let me try something that is similar. That is
Mm-hmm.
OB/GYN. It is a surgical field, so maybe I would
Mm-hmm.
like. Then when I enrolled the program and I saw like this is not the lifestyle that I want. It's completely different surgery. Yes, it's a surgical specialty, but the type of patients, type of disease, and all these kind of things, it's not what I wanted. So
Yeah.
you chance here in the Saudi residency programs to change your specialty once. So I switched, and alhamdulillah, I got matched in general surgery.
That's really good. Congratulations. Surgery is like something that everybody wants once in their life at least, but it's very difficult to get into, even in my country.
So being, the female that actually went outside because
Mm-hmm.
studying here and priority, I thought it was for students who studied here in Saudi Arabia.
Mm-mm.
For me to actually match them, that was like a huge thing.
You must have scored really high. That's, so, okay. So basically, general surgery right now, you're in the first year of residency or the second?
No, first.
First year. So, what exactly is the residency like for you?
So like um, on a day-to-day basis, we actually have clinics, AM clinics, PM. For juniors, we're more focused on the day surgery, like the simple procedures. All of it is actually supervised by our attending or our specialist.
Mm-hmm.
So there is that. And what I actually like in the program here that they give a lot of time to the residents. So we have something called
Mm-hmm.
HAT, which is meant to be for like research and academic activities, courses, or campaigns to attend. So we have that like tomorrow on Thursday, where it's like a journal club. We bring, like,
Okay. Somebody has a question as a foreign
yeah,
resident.
as I actually had to pay for my internship because I wasn't sponsored. If you were sponsored, otherwise they can pay for you.
But I think it would, that's because you are a citizen of KSA, right? What if somebody was like a foreign graduate that wasn't, do you know anything about that?
They have to pay for that.
And it would be much more difficult to get into these programs if you are not from KSA, right? Even though if you were a resident there.
Yes, actually, nowadays, like it's getting harder to
Do
match.
you
Like,
have any batchmates that are like maybe not Saudi citizens but are residents there and are now in this program?
uh, but I've heard a lot of people in other cities. They're graduates from outside, and also they're like foreigners, but they match in like different city, not in mine.
Okay. So it's like it's different for you and it's different for somebody who's not a resident and that they would have to look into. Okay. So Sana is asking, so you didn't do your internship in China, you did it in your home country. Yes,
Yeah,
she was like the first person from CCMU who kind of asked and got permission so that everybody could actually voluntarily go to their home countries and do this. I remember you asking this.
thing when we were in fourth year, like
Mm,
it as an option for everyone who wants to go back there.
yeah.
Those who doesn't want it, it's okay. You can still do it in China, but there's
Mhm.
a lot between us and the university. So I had to bring a lot of like official letters from here saying that I actually have to go there. Otherwise, like it would be for nothing. That all of the years that I've studied.
Yeah. No, it doesn't like, especially. I think these rules are changing in India as well. I think we would not be allowed to anymore use internships from China. I think it might be from this admissions from this year or something. And it would be so helpful if our university did allow that, because I think some universities do that but not ours, right?
And
Ours did not initially.
China, they do it.
Okay, so let's move on to the next question. So you right now you're in the first, like you're the junior resident. Would you have specialized courses coming up in the next 2 years or 3 years, however long your program is, or can you choose a specialized unit? So some countries have orthopedics as a completely different branch. Some consider it under general surgery.
So for us, the general surgery is 5 years program. All general surgery. The first year and the last year of the residency, it has to be completely general surgery. But between those, you get to do some subspecialties like pediatric surgery. You have rotations, vascular,
Okay.
plastic. And during your 5th year, you're supposed to, choose what you want to specialize in as a fellowship. What do you want to take, like colorectal or breast, something under the branch of general surgery.
So the 5th year would be more of what you choose, but before that, you have to go through all the rotations.
Yes, it's a mandatory. Also, we have like ICU and ER rotations.
Okay, so those are like not surgery, but you have to look at patients, and it's just a medicine rotation, basically. So how has it been different studying in KSA now as a resident than when when you were studying in CCMU?
Very different. I'm still actually navigating this. Being a student, it's completely different than being a resident. We used to complain about the amount of things that we have to learn and study, but in residency, it's like one book is like this volume. So, and you actually have to do all of it. So, and actually, our attending, he was like, you have to go through that book twice in your residency. So, and so there is that. And
but then also you have to work half of the time, right? So how do you manage that?
we have like 4 to 5 on calls, 24 hours per month. We try as much as we can that we fit some study time during the on call, but we're not actually, very lucky about that. Sometimes you're so tired because you're covering different wards. Sometimes you're covering even the pediatric ward, like for surgery. So we try as much as we can, but the hospital domain, they're actually very supportive regarding like reading time. They will give us some half days to read and study, and also they would guide us, because every year we have to have an exam to be transferred to the next level.
Okay. I didn't know it was like a mandatory thing. Like if you don't pass the exam, then you don't go in. I thought it was like a smooth transition. Okay. So basically, when you chose this program among other options, what did you like? Why did you? I already asked you, why did you choose to study in your country? You said you had different kind of. You did decide to do USMLE, but then you thought about and got into matched with the program here. So my question is that you must have friends who are studying there as well, right? So is this different in USA or UK? Would you know anything about that, or is it the same as KSA?
You mean the medical school?
No, the residency program. Like this is, I know that general surgery is 5 years for you, but I think that in India it's 4 years. So I was wondering if you knew the pattern and the subjects that are included in KSA are the same as some that are in the UK or US.
Well, I know like most of the program directors here for general surgery, they used to do their boards in Canada. So it's kind of adapted to the Canadian system.
Okay, makes sense. Every country has their own westernized. I think for China it was very Americanized, everything. What is your regular day like right now? You must be like super busy.
Yeah.
What would your regular week or regular day be like?
So we start like early rounds in the morning, check on the patient and see if there is any procedures to be done during the round. For example, dressing and so on. Then we go to the clinic, and after the clinic, we have the pre-admission for the cases that we're going to operate on tomorrow.
Mm-mm.
Have to do that, and during that, we get some consultations. OR day is clear, it's only for OR. We usually have 4 cases a day. So there is that. And next day is also, we have what's called as a ground round. The residents hate that. They actually call the residents and they start attacking them with the questions about all of the cases that we worked on. And what else? And also we have day surgery. One of the week, each resident has a day in the week for the day surgery for like minor procedures. For the big OR, get to be an assistant, but not the primary surgeon as a junior.
Mm-mm. So you might like, do do you get to resect stuff, or do you get to operate, or is it just holding a bunch of instruments and like
No,
what?
actually, the hospital that I'm very lucky to be in because they give the chance to the juniors to scrub in and not only hold their extractor, just hold the cam. Uh,
Yeah,
so
because I think retraction is like the maximum I've seen first year residents do, right?
yeah, actually, also you have to show interest. You
Mm.
have to, otherwise they'll be like, okay, just hold this. But for day surgery, the whole list is supposed to be for you, for the junior to learn, like lumpectomy, sebaceous cyst, excision, ingrown toenails, all these, basic stuff. You get to do that.
So the lumpectomies are like, are they breast related? Like, because I think breast surgeries are much more complicated than a lumpectomy anywhere else, right? It's like very specific. But would it also come under your daily procedures, or no, it won't?
Lumpectomy would be in the main OR day, not in day surgery for breast. Yeah, like we can
But you,
find lumps from the thighs, from the back, something like that.
okay, good. Um, After that, it's like just surgeries then,
Yeah.
and
And the last day of the week, we have what's called the half day for the residents, which was each consultant would present a topic and then we would discuss that. For us, as we're supposed to have 3 hours free during the week. So we do that on Thursday.
And who does your paperwork? Is it you doing it? Is it like a junior people do the paperwork, or do you have other people doing paperwork for you?
No, we.
You do that. So that's included in your daily.
Yeah.
Okay. And what do you envision your life to be like in the next 10 years? What do you think your daily schedule should be like?
I'm leaning forward to like laparoscopic surgery or something that is like
Hmm.
artificial intelligence related because I can see like this is where they're going towards these days.
Mm-mm.
I've heard a lot of programs like as a fellowship you can apply for, especially in South Korea, as I mentioned before. They have like a program between here, they exchange like
Mm.
surgeons. So hopefully I get that.
That would be really fun. I think laparoscopic surgery is like becoming so advanced right now. And
Yeah,
it's
invasive. I think I'm hoping that it's less work hours, less on call.
I think so, because open surgeries have more complications. They have more, I don't know. I just feel like patients are admitted for longer durations of time if you have
Yeah.
them go under open surgeries. Okay. Has had COVID ever affected your um, this whole procedure of you getting into residency or the exams?
For the residency, no, but during the residency last year when I was in OB, a lot of elective cases had been cancelled. We had to be really relocated. We had to work in COVID wards because there was severe shortage. But the process of matching, no, and alhamdulillah, we had to do the most of our interviews online. during the lockdown. So that worked.
Okay. So it worked perfectly because you had a system in place from
Yeah.
your country for matching. So you did 1 year in OB or less?
Almost like
9 months. So they didn't consider that when you joined surgery, you had to start from year one, right?
I had to start from the beginning.
But that's okay. I think that's like fun. You got to
As
experience two different.
that they wanted, I'm like, it's okay, it's worth it.
Okay. Who right now in your life, who are some role models that you look up to, like in terms of medicine?
You know, I was very surprised when I came back here because most of the head departments are female, and that is something
Oh.
so encouraging, and it makes me so happy. And I'm like, hopefully one day.
Yes, I think like even if you get to have a conversation with a female head, you realize that it's like it's so different for us and it was so different for them. And to
Mm.
see women do like great work, I don't know,
Yeah,
I just find it very inspiring.
very common you get to see. So I
Mm.
was really, really surprised. Okay.
Okay. So I think we already covered this question. This was like what is one difference that you noted in yourself in medical school and then working full time and studying as well?
Well, working you're like uh hands-on, you're with the patient 24/7. You know what's going on during consultations, during the you know the patient from the beginning, from the admission until the discharge.
Mm.
Where as a student, I think we just used to come and like learn about one topic and then
Mm.
we
Yeah, I think we didn't care about patients as much
yeah,
back in medical school. And now, like even working, even though they are not my patients, I know what surgery has happened and what are some things that because I think the patient goes through you from the starting to the end, so that matters a lot.
yes.
Um, Other than that, um, has it affected the amount of time you spend with your family or your friends or go out or if you have any interests?
Yeah,
Are
that it does. Like I would see my parents when I came back from work and then I would sleep because you're so tired, especially after the pulse. It was like exhausting. So in the beginning, yes, but you try as much as you can to balance between life and between work. And
would you say that you have it like you have it figured out to some point right now, or you still have a few things to?
of course, I still have a lot of things because I'm still in my first year and there's a lot of things to go through. So ask me this question after you. Let's see how it goes.
Okay, next, like you have to take it every step by step every year. So right now, who are you the most grateful for at your workplace?
At my workplace,
Mm,
hmm, maybe like our chief president. She's very,
okay.
you know, she goes with us like, to everything and she takes it step by step and she knows like I know this is new, I know everything is like looks very scary at the time, but it's okay, we've been all through this journey and we'll guide you through it.
Do you have to have a lot of interaction with other specialities, or do you have to know details about other specialities as well? So,
Mm.
for example, would you say, as a first year junior resident in general surgery, get to interact or have major interactions with somebody who's doing uh, like a neurosurgeon, of course, because he's in surgery, but
Yeah,
somebody who's in medicine or someone who's, let's say, pediatric medicine or OBGYN, or it's like very limited right now?
it depends on the patient. If we have a patient that has, for example, last week we had a patient who had cardiac surgery, so we had to involve cardiac surgery with us and we had to sit down and see like the type of management that we would do for this patient. And you
And do they expect you to know these things? Do they expect you to know? So cardiac medicine,
know,
would you be expected to know that, or do you study a day before or after?
think about the case, about the history. You have to take a detailed history and to know what type of cardiac surgery he has, why did he have that, and how long ago, what type of medication.
Okay. So the next question is, do you believe that different type of people are best suited for different specialities?
I think so, yeah. And, for these kind of specialties, you really have to have a thick skin. Otherwise, you wouldn't survive like the residency because it's really hard.
Is it the same for you as well in KSA? Because I know that in India it's like that, and I'm not sure about if um, it's a similar situation outside. It's almost like you're getting bullied, or people expect you to know things when you know you're.
Yeah. We actually had this situation been going on for like a couple of years now. So they started a program called Resident Wellness because a lot of people were either getting depressed or burnout because of the type of, behavior they get. So these years, like for the past 3 years, they're trying to improve the environment for the residents. Hopefully,
That's really good.
hopefully we would see better things, but I'm very grateful that the hospital that I matched in, everyone speaks about the good environment that surgeons have there.
Yeah, I think even hospital would matter. Are you right now are you in Riyadh or some other place?
But Eastern region.
Okay. Um, okay, let's move on. Do you think gender has a role in what you chose to study and specialize in still? Like,
For matter actually, but like during interviews I would get that question a lot, like, are you sure you want to go to a general surgery because you're a female and working hours are very long and blah blah blah, and I'm like, yeah, this is what I want to do. Actually, what's so funny that we were 20 residents who applied. 15 of us were female and only 5 males. So they didn't have a choice.
so for the second, uh, so when you applied for your residency, you have an exam, right?
Yeah.
So did you have to take the exam again second time you wanted to match with surgery? Because I had this question in mind, but I forgot to ask.
It's okay. I can use my previous exam because it has like 5 years validation. And for us, it's not only an exam. There are things that you have to do too. You have to work in a research. You have to do health campaigns, and they take your GPA also and calculate it.
So, for your research, what did you submit? Did you do your research while doing internship in KSA, or did you find something in back in Beijing?
Actually, I don't know if you remember him, the doctor that taught us internal medicine, the Chinese. I worked with research, and luckily it got published. And when I came back here, I submitted, and they accepted it.
What kind of work did you have back then, like in the research project there?
Mainly, we were like data collectors.
Okay. Makes sense. That was like I think because here people struggle a lot with finding research opportunities.
Yeah.
It was like I don't know. I just felt like having a research unit right in our university kind of helped a lot in case you wanted to
Yeah.
find research to get into, because a lot of countries do require you to be part of some kind of research program in
It
your
is
undergraduate.
that you have at least like one research. It used to be at least two research because people finding it so hard. So it's been only one research, and it has to be.
It has to be published. Okay, I think let's move on. Do you think gender has affected your education or the experience you have at work personally?
Not really, but like just what I mentioned, that incidents during interview.
The-
Like, are you sure you want to go? Everyone, for some reason, think that because you're a female, you should go to family medicine because it's just like less working hours and very benign.
Yeah, I think working hours is like it's like a thing. People want you to choose less working hours as a female. And how have people responded to you being a foreign medical graduate in your country? Do they think less of you, or what kind of a response do you get?
Actually, in the beginning of an internship, I was very anxious about that because we
Mm,
hate jokes like, "Oh, you graduates from China, you have a
mm,
Chinese, whatever." But once you start working and they see like how you know interested you are and you're actually very keen on learning and all of that, they would change their mind. Not all of them, but let's say that I managed to change some minds.
And do you think that being a foreign medical graduate or studying in China had any impact on how you approach things in life in general or in at work? Has it given you some sort of advantage over people that are from, like, somebody who is from Saudi Arabia, studied in Saudi Arabia, lived at home? It's like a positive thing.
Yeah. See, the thing is, our university had a lot of nationalities, so that works for us because you get exposed to different cultures and you have to interact with a lot of people. And when we came back here, we have also a lot of foreigners in the hospital, so it actually
Mm-mm-mm.
know how to
Ah,
work, accept also everyone's backgrounds and everyone's culture.
makes sense. Yeah, and then I think when you're in your own country, you're filled with preoccupied ideas of what people think certain people are. And I think being in our university changed that for us. At least for me, it did greatly.
Yeah,
So if somebody is interested in studying general surgery, what should be some things that they should definitely think about before taking a step towards general surgery?
I would say that take attachments like or elective just to make sure that this is what you want, like for at least 2 months. Know the type of work that you have to do, and if you're okay with staying like in the hospital for long hours and you have to sacrifice a lot of your personal time too, then go for it. But make sure that this is what you want. Because during internship, there's a lot of options and we go through a lot of rotations. So sometimes that would make you very hesitant about it. So after
Mm-hmm.
this is what I did actually. I took 3 months in general surgery.
Who should, like, do you have some people in mind that should not apply to general surgery? It would just be people that don't want to give up time, right? Or is it,
I
would
don't
there be some other personality traits? Or
I don't know. I don't think that I have the right to choose for them. I mean, if you want to go for it, if you don't want to, just if you want to give it a try at least,
then
wouldn't
elective is a good idea.
electives actually were very beneficial.
And what should they prepare for? Like, how should they prepare um, to, start rounds? Like, what should they be studying? Are there any books that you would advise or anything? I don't know, like, uh, for example, somebody who's entering ophthalmology would need certain instruments. Are there some things that have helped you through the residency that they should
Uh,
start with?
During here, during the COVID, there's a lot of courses that I attend, like basic surgical skill courses and how to tying the knots and how to manage like chest tube and central lines, all these kind of
Mm-mm-mm.
procedures. So this actually helped a lot. Also, you can include it in your CV that you've attended surgical courses or camps.
Ah, okay.
And
This is good advice because although I know how to do a lot of things, just because I don't have certification for them, I might not be able to include it in my CV.
yeah, also they you can buy those kits if you're really interested. I bought mine from Amazon, the suturing kits, and nowadays they actually have a laparoscopic set that you can buy and connect it to your computer, and that it would stimulate
Mm-hmm.
black hole laparoscopic cholecystectomy.
The
which is
laparoscopy would
fun.
be something that you do at the end of your. It should be something that's like in fourth or fifth year, right? Not immediately.
The laparoscopic, you mean?
Yeah,
Yes, towards the
towards the end. Makes sense. Okay. I think we've almost done with like 30 minutes. Thank you so much for coming and discussing with us.
end.
I had so much fun. Okay. Um, if anybody has any questions, I would forward them to you. Is that okay?
Yeah,
About
sure.
surgery? Okay. Thanks a lot. Bye bye. Have a good day.